Hi guys, welcome back to class. I hope you've enjoyed your half term. So we're going to be continuing our discussion on the restructuring of the health and social care. So today we're going to be focusing on the effectiveness of that restructure. And as a reminder, the act we're looking at is the Health and Social Care Act of 2012. So the aim for today is to look at this new structure and what would have been your assignment brief, which, reminder, is not your assignment, would have been to analyse the effect of government reforms and organisation. To analyse the effect of the 2012 Health and Social Care Act on healthcare organisation. So last week or 2 weeks ago we discussed what the new structure looks like, but today we're going to be asking ourselves what is the purpose of the restructure and the effectiveness of the restructure. So the Health and Social Care Act provided the biggest, most radical restructure of the National Health Service. But specifically, the Act removed the responsibility of the health of citizens from the Secretary of State to the Department of Health. So it's that change of power that I mentioned from politicians to clinicians. Okay, so that's one specific thing that the Act did. And it abolished NHS Primary Care Trust and Strategic Health Authorities. And in its place, we have clinical commissioning groups. It also established the creation of the now popular Public Health England. Okay, so to recap, the Health and Social Care Act is the most radical, biggest restructuring of the 1948 National Health Service in England. It specifically removed responsibility from politicians and moved that responsibility to clinicians. So the responsibility of the health of the citizens moved from the Secretary of State to the Department of Health. It abolished PCTs and SHAs and then gave their responsibility of commissioning healthcare services to clinical commissioning groups. And also in 2013, for the first time, we had Public Health England. So, okay, so why did we need this massive restructuring? As with anything, really, as time moves on, things change. And in order to keep up with the growing demands of things, in order to keep up with the times, if you like, modernisation is essential. So the NHS wanted to keep up with the founding principles, which is, for the most part, health to be free at the point of need to everybody, irrespective of how much you have. But as we know, there is so much demand. There's rising demand for treatment and healthcare. So in order to keep up with the principles, we needed to modernise, we needed to restructure. Yeah, so need for improvement. The state of public finances was, shocking at the early 2010s. So with the new government, coalition government in 2012, something had to be done in order for the NHS to stop being a money drain on public finances. And also, we now had, as a nation, we have experiences from previous reforms. Like I said, the first reform was in the 1980s, and then we had another in 1997. So we have gained experience from two previous reforms on what to do right, what we've done right, and what we've done really wrong. Commissioning, which is the buying and selling of healthcare services, needed to be clinically led. So who is going to be able to answer the question, what do people need for their health? Is it going to be a doctor, or is it going to be a politician? Okay, I'll let you answer that. So commissioning had to be clinically led. And they wanted to obviously create a greater voice for patients, which has always been the campaign of any reform that we've had. I don't know if that works, but hey. And obviously more focus on public health. That's prevention. Prevention's better than cure. And with this structure, there's more accountability because there's a clear kind of management structure, who's accountable to who, and how does money flow from NHS England down to hospitals. Okay, again, this is how the new system would work. Okay, I hope that you are understanding this complex structure, which really is a simplified version of what it actually is. Okay, so the effect of the government reform on organisation. So the purpose of the structure, the restructuring, was that there would be improved access to health for all. They would tackle health inequality, which after the 2010 Marmot report was a very, very hot topic, and so clinicians are asking the government, what are we going to do to tackle health inequality? And 2 years later, with the new coalition government, just said, okay, we're going to do this restructure with the aim of tackling health inequality. Improved quality of service and accountability for the quality of service. So they created quite a lot of SLAs, which is like standard delivery of things. And if for any reason those standards weren't met, they would be evaluated, and accountability also means improved oversight and leadership. And obviously to keep with the founding principles of the NHS, which would be to promote and protect the health of everybody. Okay, so 7 years on, do you think that this restructure was actually necessary? And would you say that it has done what it set out to do? So just to recap, this is a very short kind of criteria. Just to recap, we've got 4 questions that I want you to bear in mind. What is the restructure? What did the restructure actually do? So what is it? Why did we need it? Okay, this is their case for change. This is why we needed the restructure. How is it going to work? Okay, we kind of explained how is it going to work in the first criteria. And then, what is it going to achieve? So what is it? Why did we need it? How is it going to work? And what is it going to achieve? Okay, now bearing those 4 questions in mind, I want you to have a think and just put your comments in the comment section. Do you think that this restructure was necessary? And if it said that it was going to improve access to health, tackle health inequality, improve quality of service, create a greater voice for the patients with evaluation and feedback, improve leadership and oversight, and protect and promote the health of all, would you say it's actually done what it set out to do? Okay, right, can't wait to hear from you. That's all for today. We're not having a Teams video, so take your time, answer these questions, and then enjoy the rest of your afternoon.